What is Datroway? Drowe Deadopotomabd Duxicin infusion is used to treat metastatic HR positive, HER2 negative breast cancer to help slow cancer progression. It can be used in patients who have already had certain treatments, whose cancer cannot be removed by surgery unresectable, or has spread metastatic disease. Datroway is a Trop-2-directed antibody and topoisomerase inhibitor antibody-drug conjugate. Datroway is given as an infusion into a vein for infusion once every 3 weeks, and will usually take half an hour after your first dose. Datroway FDA approval was granted on January 17, 2025. After positive results from the Tropian Breast 01 clinical trial NCT 05104866, which show a statistically significant increase in progression-free survival PFS, which is how long it takes before cancer gets worse or progresses after treatment. What is Datroway used for? Datroway is used to treat breast cancer in adults whose cancer is hormone receptor HR positive and human epidermal growth factor receptor 2 HER2 negative breast cancer. It is unable to be removed by surgery unresectable or has spread to other parts of the body metastatic, and the patient has already received endocrine-based therapy, hormone therapy, and chemotherapy treatment for unresectable or metastatic cancer. How does Datroway work? Datroway is an antibody-drug conjugate ADC, which is a medicine that has 3 sections: a monoclonal antibody mAb that binds to proteins called TROP2 trophoblast cell surface, antigen 2 on the cancer cells, the anti-cancer molecule called DXd, a linker that joins the mAb, and anti-cancer molecule. Datroway works by the mAb section binding to TROP2 proteins on cancer cells. It then passes into the cells where the anti-cancer small molecule DXd is released, causing the cancer cells to die. Datroway mechanism of action is Trop-2-directed antibody-drug conjugate. Datroway side effects. Common Datroway side effects. The most common side effects of Datroway include mouth ulcers and sores, 59%, stomatitis, nausea, 56%, tiredness, 44%, fatigue, hair loss, 38%, alopecia, constipation, 34%, dry eye, 27%, keratitis, 25%, vomiting, 24%, rash, 19%, low appetite, 16%, COVID, 16% cough, 15% diarrhea, 11% abdominal pain, 11% lung problems, 15%. The above side effects occurred in 10% or more of patients in the Tropian Breast 01 clinical trial. How will I receive this medicine? Datroway is given as an infusion into your vein by your healthcare provider. It is usually given once every 3 weeks, 21-day treatment cycle. The first infusion is given over 90 minutes. Then if that goes well, your next infusion are given over 30 minutes. During and for 1 hour after your first 2 infusion, you will be monitored for side effects. And if all goes well, you will be monitored for 30 minutes after your next infusions. You will be given medicines before your infusion to help prevent nausea, vomiting, and infusion-related reactions. If you have an infusion-related reaction, your infusion may be slowed down, temporarily stopped. If your reaction is severe enough, you may need to permanently stop Datroway. Datroway dosing information. Recommended Datroway dose is 6 mg kg, given as an intravenous infusion once every 3 weeks, 21-day cycle until disease progression or unacceptable toxicity.